Proper isolation during technique-sensitive dental procedures is important, but is also sometimes very difficult to achieve. Proper placement of a rubber dam can improve the quality of dental treatment in many ways. Rubber dam placement allows the clinician to achieve a dry field by isolating the tooth indicated for treatment from oral fluids and other oral tissues such as the lips, cheeks, tongue, and gingiva. Rubber dam placement protects the patient from swallowing or aspirating debris and dental objects that are used during the procedure. It also protects the tissues from irritating materials used for the procedure, such as acids for etching enamel. Today, we will be demonstrating the application and removal procedure of the rubber dam. Let's take a look at the tray setup for rubber dam placement. The armamentarium consists of a mirror, explorer, cotton pliers, scissors, the rubber dam frame, rubber dam clamps, a clamp forceps, the rubber dam punch, pre-cut stamped rubber dam material. Here we have green, which is latex free, and gray, which contains latex. Dental floss, an inversion instrument such as the beaver tail, a cutting instrument, we have Black's Gold knife, and stabilizing equipment, the wooden wedge, floss, and a small section of the rubber dam material. First, we will determine the teeth to be isolated and the tooth that is to receive the rubber dam clamp. Today we will be preparing the dentition for procedure on tooth number 20. Since the clamped anchor tooth is distal to the tooth receiving treatment, number 18 will be our anchor tooth with the clamp, and teeth 19 to 22 will be isolated with rubber dam material. Next, we will punch holes into the pre-cut stamped rubber dam material to correspond to the teeth that are to be isolated. The punch has a rotating punch plate and point that creates holes of different sizes. The largest hole is to be used for the clamped tooth or anchor tooth, which will be number 18 for our procedure. The second largest hole is used for molars, so we will use this size for number 19. The third largest hole on our punch is used for premolars. The fourth largest hole is used for canines and maxillary centrals. The fifth largest hole is used for maxillary laterals and mandibular incisors. If a sixth size is present on the punch, this would be used for pediatric dentition. After our dam material is ready, we will select the proper clamp. There are winged and wingless clamps, or those with and without projections, available in different sizes for primary and permanent teeth. Today, we have clamps with wings on our tray for anteriors, premolars, and molars. Our anchor tooth is a molar, so we will choose accordingly. Next, we will prepare the clamp. We always want to secure the clamp with floss to prevent patient aspiration if it were to spring free during the procedure. The floss tail allows for quick and easy retrieval should this happen. Before placing the clamp, we also want to check that the contact areas to be isolated are open using dental floss. To apply the clamp, you'll engage the clamp forceps into the holes on the clamp and squeeze the handles gently to place on the anchor tooth, usually lingual to facial, and keep the clamp stabilized with the index finger while releasing. Check for stability by making sure that all four corners of the clamp are seated on the tooth and not on the gingiva. Now it's time to place the rubber dam. Use the cotton pliers to reach through the largest hole and pull the floss through. Place the largest punched hole over the clamp and gently stretch and work the material carefully under the wings of the clamp. You'll continue to stretch and manipulate the dam material into position until the correct holes correspond with the proper teeth. Once the material has been positioned, we will place a ligature at the opposite end of the anchor tooth to stabilize the dam. We will be using floss for our demonstration on tooth number 22. You'll wrap the floss around the lingual aspect of the canine and then tie on the facial aspect to secure. When tying, you'll use a left over right and then right over left, or vice versa, to make your knot tight. We will stabilize the rubber dam using two other ligature techniques. First, we will use a small corner of rubber dam material. Stretch the material until thin enough to manipulate interproximally, and then release to secure. Another type of ligature is a wooden wedge. Using a cotton plier, hold and place the wedge from the facial aspect. The flat side of the wedge should be positioned toward the gingiva. Apply pressure towards the contact until the wedge is secure interproximally. Using the inversion instrument, or the beaver tail, we should then invert the rubber dam around the necks of the isolated teeth. This will make sure that all the gingiva, including interproximally, is covered and provide a well-sealed working field. During a procedure, you can also use the air syringe to assist with the inversion and to thoroughly dry the area. Lastly, we will place the frame on the outside of the rubber dam. Stretch the dam material and hook onto the projections around the perimeter of the frame. Make sure that the dam is smooth, not bunched up in any areas, and free of tears. Make sure the rubber dam covers the upper edge of the lip, but does not cover the patient's nose. You are now ready to begin your dental treatment. Removal of the rubber dam is just as important as the placement. During removal, we want to avoid any injury to the gingival tissue and make sure there are no remnants of material left behind. First, we will engage the forceps in the holes on the clamp and squeeze the handle slightly to remove. Once the clamp is removed from the field, we can unhook the dam material from the frame and remove that as well. Now we can begin removing all ligatures. The wooden wedge will be grasped firmly with the cotton pliers and placed on procedure tray. The rubber dam corner will need to be stretched slightly to remove from the interproximal area and can also be put on the tray. The floss ligature can now be cut and removed. Remember to position the sharp edge of the instrument away from the gingiva when cutting. Then we can pull the dam slightly in a facial direction to see the interproximal dam areas clearly. Using a fulcrum and scissors, cut the interproximal dam area carefully. Again, with the scissors pointed away from the gingiva. Now, the entire rubber dam can be removed. Once this is done, inspect the rubber dam to be sure there are no areas missing. We should see distinct circular openings where we punched previously. If anything were to remain, we should use an explorer in the interproximal areas and remove any remaining pieces, as they would cause gingival irritation. Lastly, we would floss the teeth, once again checking for any remnants, and finish by massaging the gingiva around the clamped tooth and ligature areas for comfort and to increase circulation.